live on DJ Bandz Radio. It's DJ Bandz, and we got a call on the line. Just tell everybody what's your name, where you're from, and and we can get this thing started. How you doing, by the way?
I'm fine. Hello, everyone. My name is Latonya. I'm from SPARTA, Georgia, and I am a recovering COVID-19 patient.
Okay. It's unfortunate situation, but the reason why we're here today is to tell the people, how you felt, your symptoms, and the whole process to recovering from the COVID-19, because it's a pretty serious thing right now, and that everybody's going through it, and some people taking it lightly, and some people, they actually trying to keep their hands clean. They trying to stay inside and do the social distance and everything. So what was your first symptoms, or did you have any symptoms at first when you found out?
I did have symptoms. My symptoms started off as body pains. I started with lower back pain. And from that, it went to body chills and body aches and slight fever. I didn't have a high fever. I was feeling feverish. And, it started off as that, and I took Tylenol for it, and I perked back up. So I thought I was okay. And that started on a Thursday. And about after Saturday afternoon, I couldn't taste or smell anything.
I know they said that was one of the symptoms. They just newly posted that recently, saying that a new symptom was you can't taste or you can't smell anything. So once you started feeling the chills and everything like that, did you went to the emergency room, or you went to the health department? What you do?
I called my doctor office after, when I took the Tylenol, I perked back up, I just put it aside as maybe I was, maybe catching a cold or something.
Right.
Because that's how my body reacts when I'm getting sick. Mm-hmm. And when I lost my taste and smell, I knew that was a symptom that I read on the CDC website. So I made an appointment with my doctor office Monday. I went in and got tested. And they called me Wednesday morning and told me that my results were positive.
Oh, man. Okay. So the testing, what did they do, when you got the test? Everybody, saying that they stick the Q-tip to the back of your brain. And
yeah, it's very uncomfortable. The test is very uncomfortable, and they have to swab both sides of your nostrils. Oh, so, the test isn't something you would want to do, but you have to get it done if need be, and I have to get it done twice because I got to make sure I'm negative now. Before I could bring my daughter home or go back to work, I have to make sure I have a negative test result. So unfortunately, I have to do it again.
Okay. With that being said, you're saying bringing your daughter home, you're not being able to spend the time with your family, your loved ones, and everything like that. I know, Mother's Day just passed. How was that experience, not being able to spend Mother's Day with your kids? It
was a painful experience for me, not because I'm so close with my daughter and I'm so used to being around her almost every day, and to have to spend Mother's Day away from her and her wanting to see me and hug me, and that just took a toll on me. And it can get very lonely and being isolated from your family. I was experiencing anxiety and things like that. Even just having the virus, it makes you anxious because you don't know if your body would take a turn for the worse the next day, or you never know what it's going to do to your body, because you hear all these stories about healthy people, just their oxygen levels are dropping down to 50 out of nowhere. And that was something that had me on edge a lot, because I didn't know how my body would, react to this virus and me being here by myself. And it was scary. I had a lot of anxiety dealing with this coronavirus.
Okay. So I know a lot of people say symptoms about hardly breathing, and did you have any, complications with breathing, your respiratory system, anything like that?
Luckily, I guess I had a breathing problem one morning. I had to take myself to the hospital, and I was thinking it was probably results of my anxiety, because when I got to the hospital, they checked my lungs and everything, and they said that my lungs was clear. But I can say that it did affect my blood pressure because I have high blood pressure, and it had my blood pressure numbers triple digits for like 3-4 days. And now on top of taking my medicine, my blood pressure was still abnormally high. So yeah, it affects your body in different ways, and it's not a one size fit all virus. It affecting different people in different ways, and that's the scary thing about it, because you don't know how the virus will react in your body.
So how long has it been since you first been, when you first started feeling your symptoms that you was, when you found out that you had it until to today? How long has it been?
I first started showing symptoms on April 30th, and I got tested on May 4th. May 4th or 5th. Yeah, I want to say May 4th. It was a Monday. And the doctor told me to quarantine for the 14 days from onset of symptoms. So my quarantine actually ends tomorrow, but I'm trying to be safe and make sure I get tested and get those negative results back first, because I don't want to risk infecting anyone, because it has been people that tested positive even after they quarantined the 14 days.
Okay. So I know it's going to be hard on you if it's already hard on you enough right now. And I know it's going to be truly hard if you go, your quarantine date's supposed to end tomorrow, then you go get retested, and, Lord knows, hopefully that you negative, but if you're positive, you have to, you have to get your mindset ready for that in case you're still positive. I know it's going to take a longer process on you, keeping you away from your daughter, and your loved ones and everything like that. So, go ahead.
Yeah. And the thing with this, you have to keep, if you're healthy enough to quarantine, you have to do something to keep yourself busy. And luckily, I informed myself a lot with this coronavirus, with the COVID-19. I made sure to, always take vitamin C, vitamin D pills. I tried to, at least go outside for 10 minutes a day, get some sunlight, drink my lemon water, drink my hot teas, and try to at least keep myself healthy.
Okay.
And, eat my fruits, vegetables, I try to at least fight my body, give my body the nutrients it needs to fight the virus.
Fight it off, yeah.
Yeah.
So how are you feeling right now at this moment?
I'm feeling great. I'm very blessed, and I thank God every day because I'm not in the hospital, and I know people who are fighting this virus, and they're in hospitals and on oxygen machines, and luckily I was blessed enough to have a strong enough immune system to fight this virus.
Okay. So do you have like a support system? Like you need to just get things from the grocery store, or or something to eat or drink, or running out of water, supplies, or hygiene? You have a store runner, somebody who goes to the store and get those things for you?
Yes, luckily I had a very good support system throughout this whole process. My mother, my boyfriend, my sister, some of my family members, friends, they made sure to call and check on me. I video chat with my family almost every day and check on my daughter almost every day, me and her video chat. So the process hasn't been as bad as it could have been. Luckily, I had people in my corner. I got a good support system.
That's good. You got to have that support system, especially at a time like this, because, everybody's thinking that, the coronavirus, it can't get me. I'm physically fit. I'm healthy. I exercise. I'm young. And if you don't mind telling your age for the people who's listening, you don't have to be exact. I know, women don't like to tell their exact age.
I don't mind. I'm 30, and I can say I want to let the public know this virus is highly contagious. Okay. I mean, I work in a nursing home facility.
Okay.
And I had all the proper PPE. I made sure to dress down each time I went into a potentially infected person residence room. I
Yeah.
mean, I was dressed down, everything. But it just goes to show that even if you're wearing the proper equipment, even if you're doing the right things, it's a chance you could still very much likely catch this virus because it's just that highly contagious.
Yeah. Okay. So how long you think this virus will stay around? Just off the top of your head, just, a general question, how long do you think this pandemic will last in the United States and all across the world?
From looking at the numbers and looking at news every day, I don't think it's going anywhere anytime soon. And I partially blame that on the virus spreading as quickly as it did in our country. I partially blame it on government and negligence of the common people.
Not taking execution early enough.
Yeah, I think if procedures was put in place early enough, it wouldn't have spread as quickly as it did, and it wouldn't have got as bad as it did. Because we have the highest number of cases in the world, and I think that's partially to do with negligence on the government's behalf, and not putting the safety of people first. Because I mean, we knew this thing was out there, and it should have been plans and proper PPE in place, especially for healthcare workers, knowing that what we were up against. Yeah. Because a lot of facilities got PPE weeks after this pandemic started. Man. And and in closed facilities like nursing homes and places of that closed environments, it could spread very easily because people are in closed environments, and there are two people to a room, and and it being as contagious as it is, I just wish that more thought was put into and more care from our government.
Yeah.
And I just feel like it was just negligence on their part for it to spread as quickly as it did.
Okay, so what are your thoughts about school, with the virus going on and everything, and the next term that school starts? How do you feel if they decide to, open the schools back up? Would you, are you in open arms to let your child go back to school, or are you leaning more towards the digital?
Honestly, I'm not really open to my daughter going back to school. Now, thinking if it is still, the numbers are still going up like they are now, I'm not really open to it, because I feel like children are, even though, we try to teach them you wash hand washing and proper hygiene, I feel like sometimes it's hard to do with one or two adults to 20 kids in the room.
Mm-hmm.
And children sometimes they forget to cover their nose when they sneeze, cover their mouth when they cough. And, I'm in fear of that. I'm really in fear of sending my daughter back to school at this time.
Okay. So, when you got tested, how long did it take? About 3 days to get the results back?
It took me 2 days to get my results back.
Okay.
2 days.
Yeah, I can't get past how they stick that Q-tip all the way in your nose like that, man.
Yeah, it is very uncomfortable. I had to ask the nurse to give me a minute to kind of prepare myself for the right now.
Wipe your tears away. Wipe your tears.
Yeah, it makes it's very uncomfortable. It's very uncomfortable.
Do they have like a alternate, maybe blood or? Yeah,
I heard there's an alternate test. My mother, she took a COVID-19 test, and she actually had they did the finger prick test with her where they drew her blood. But I wasn't so fortunate, which is okay, because, I was just worrying about making sure that I did, whether I did or didn't have it, because I didn't want to risk, passing it on to my daughter or anyone else. So
on a scale of 1 to 10, with 10 being the worst, how bad was the feeling of, getting tested?
It's up there. I say about an 8 or 9.
Ooh, wait.
Like because it's they have to stick it up. It goes up there. It brought tears to my eyes. It really did. I can't lie about that. It brought tears to my eyes. But
you had to warm it up.
It's better to be safe than sorry. I will put that out there. It's better to be. I mean, we'll go through worse things in our life. I'd rather take that test to be hooked up to IVs. Pray. And I just rather take the test to be safe than sorry. It's a lot of uncomfortable things we have to do in life, and that's just one of them.
Okay, it sounds like you're doing real good and you're in good spirit, and so anything that you would like to try to put into people's head that's listening right now, or any advice that you would like to give the people who's listening, to prevent or just take caution, or just go ahead and just tell the people what you think.
I think it's very important to wear masks when we go out in public and practice the social distancing, and the masks are very important. Even if you're not showing symptoms, you could be asymptomatic and have it and you don't know. And it's best to be safe than sorry, not even just for yourself, for others, for the elderly, the people with the weaker immune systems and stuff like that. We have to be conscious of others. We have to be considerate of others. And, I would tell everybody, wear your mask, make sure you wash your hands, sanitize, and practice social distancing.
Okay. So I know with you being testing positive is kind of maybe, I don't know your situation, as far as finances, put you in a bad spot with financially not being able to work or anything like that. Has that affect you with your work?
Yeah, me not being able to work, that affected me somewhat, but luckily I had a good support system, and I did have some funds saved from work, so I'm still able to maintain well. But with this virus, it puts you between a rock and a hard place, because especially healthcare workers, because it gives you a dilemma if you want to go back to work and risk reinfection and stuff like that. It really puts you between a rock and a hard place.
Okay. Well, like I said, man, it sounds like you're doing pretty good. I wish you the best. Hopefully we can hear some good news on your test tomorrow. If you don't mind, try to update me, and, I do what I can to put the word out there, and, and make people, take caution and take this thing a little bit more serious. But but first of all, I like to say I appreciate you for taking the courage to to call in and speak to the people from your perspective, let people know how you feel and what you've been going through and stuff like that, so people can kind of hear firsthand, because you're local, you're right around the corner from some of us, and people looking at the news, and these people are not from around here, so they were like, they over there, they could be telling the story, just to get attention.
It's very real. It's very real.
So, yeah, but like I said, I appreciate you for, taking the courage and sharing your story with me. So, just like I say, just keep me updated, and I appreciate you for calling. And then if anything else you need, man, I'm just one call away. Just hit me up, and, it's all love.
I appreciate it. Thank you.
All right, you're welcome. But, appreciate everybody for checking in with Latonya Jones, and this is DJ Bandz Radio.